Welcome back to another edition of Coffee Convos. I'm Dr. Matt. Today we're at Seeds Coffee at their Homeland location, enjoying their Iron Fist blend. Big thanks to Erica and Caleb for our pre-show spread. So, if you're new to this little segment, here's a rundown. We want to bring you conversational topics that have some tie to physical therapy or health and wellness. Occasionally we'll have on guests that will help me facilitate conversation when the topic is out of my area of expertise. So today we want to talk about self-pay or cash-based practice. A cash-based PT practice allows you to pay out of pocket for physical therapy services. They might be within a current insurance model, or they might be strictly a self-pay clinic. Some of the benefits of this is it's good for physical therapists as far as reimbursement is concerned. It's also another option when your insurance visits run out. So if you're currently seeing a physical therapist and let's say you're only allotted 12 visits, well, let's say your case is a little bit more complex and you need some more, but your insurance is going to deny those claims, you can transition to a self-pay option that will allow you to keep going when it's medically necessary for you to do so. I think some of the weaknesses of a self-pay model is that some physical therapists are claiming that a self-pay model or a cash-based practice will allow for more quality of service, and I really don't think that's the case. They kind of link higher quality of care with more time spent with the patient. And I can see how that might lead to better clinical quality. But just because you're a cash-based clinic doesn't mean that those two will coincide. If that were true, then the people that paid out of pocket, the people that had the highest reimbursable insurance, or like in the case of Medicare that required one-on-one PT service, they would get the best outcomes because they would be getting the highest quality of care. And that's just not the case. And so I think any cash-based practice that is claiming that you will receive higher quality of care is kind of missing the mark there. Regardless of payer source, it shouldn't dictate your quality of care. The physical therapist's skills and abilities to really relate to you, really assess what's going on, and from that assessment, treat any musculoskeletal performance deficits that you have is going to lead to increased quality of care, not necessarily how you're paying for those services. I think some opportunities for the profession overall is to understand what is required through your own practice act, through your state, what's within your scope of practice, and not just what insurance is requiring you to do on a day-to-day basis or requiring for documentation. And so I think that if you expose yourself to this cash-based practice, that if you really understand how that works, then you compare that to your current insurance model and really expand your skill sets. I know that one of the articles I'll be posting talks about wellness visits. And trying to implement those in your current insurance model, I think would be a great way for you to give back to your community. And so I do think that a cash-based practice or a self-pay option would help grow the profession. But again, just to reiterate, I don't think that just by going cash-based, just by having a self-pay option, is not going to lead to more quality of care. I think that's just kind of a flawed logic there. All in all, I do think that cash-based would be beneficial as long as you're in a setting that your patients could afford that. I have a lot of patients right now that if we kind of switch to a cash-based model, wouldn't have the necessary means to pay for physical therapy services. I did find it interesting in one of the articles that it talks about the different frequencies regarding a cash-based model that insurance might dictate that you're there 3 times a week. Whereas in a cash-based model, you might only see your physical therapist once. And again, I think that's kind of dumbing down your clinical decision making on the frequency and duration of people's care. It shouldn't matter how they're paying for services. If somebody needs to be in your clinic giving quality of care 3 days a week, they need to be in there. So, I think that is another limitation of the self-pay model. That if I need you in there to put in some good work 3 times a week, like that still might be a lot as far as cost is concerned. Once again, a big thanks to the folks at Seeds Coffee for allowing us to use this space to bring you today's topic. As always, post in the comments if you have anything to add to our Coffee Convo. Send us a message if you want to dive a little bit deeper into today's topic, or have a suggestion of something you'd like to see us cover next. Feel free to share this video so that we can reach more people. And be sure to like this page and follow along and follow our other content.